talking about the blood-brain barrier in multiple sclerosis. How with multiple sclerosis, we have an altered blood-brain barrier, and how that is a very important observation that they've made. And it really is hugely implicated into the cause of MS. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with MS over 30 years ago, but I'm happy to share that I have learned early on that MS is caused by infections. And so as I went to work taking a different approach to treating the infections instead of living with the disease and just treating symptoms, I have been able to live an amazing life free of MS for over 30 years now. And we have supported over 700 students in the Live Disease Free Academy, and we've learned a lot. And number one, we've learned that infections are causing all the symptoms in multiple sclerosis. And so then we're looking deeper to say, okay, how did we get to this place with chronic disease? And that's a really important part of recovery. Hi, Julie. Just wanted to share that in order to make sure that we never end up in this position again once we recover, we have to look at our health history, the health history of our parents, and the circumstances in our life that brought us to this place with chronic disease. And as we do that, we really see that this is not a mystery. It's not a mysterious disease. It is not just something that our immune system is attacking itself, but that there were really specific things that happened in our life to bring us to this place. The value of that is that when we recover, when we treat these infections and recover, then we can make sure that we never end up in this position again. It is called wisdom. So in talking about the compromised or altered blood-brain barrier, it's not just in multiple sclerosis, but it's also in many different types of chronic diseases, especially diseases that have neurological symptoms. So this could be Alzheimer's, it could be dementia, multiple sclerosis, epilepsy. Let me just take a look at the list here, but it's huge. Schizophrenia, ALS, PLS, Parkinson's, meningitis, and many other, Parkinson's, I said. So many other conditions. So in these conditions, there has been some altering or compromise to the blood-brain barrier. So before we go into it any further, let's talk about what the blood-brain barrier is. So some of you may know that there is like if we get sick, we have leaky gut. You may have heard that before. So we have barriers in our body that prevent toxins and disease-causing microbes from getting into our body. And so we have that intestinal lining, and they're called tight junctions. So we have this lining in our intestines it's selective. And this is the same thing going into our central nervous system. These barriers are selective. They will only allow certain nutrients to go through, certain molecules to go through. They will definitely ward or just prevent other toxins and pathogens and other things that shouldn't go into our body, whether it's our blood, if we're talking about the intestinal barrier, or if we're talking about the blood-brain barrier. We want to maintain a healthy brain and spinal cord and an environment where our nerves can grow and flourish. And to do that, we have to protect. So if any of these invaders get through the intestinal lining, we still have the blood-brain barrier that is supposed to keep them out. And because of the work we do, we really understand that when we are dealing with chronic disease like MS, ALS, PLS, we are dealing with a parasitic infestation. And so then we might wonder, well, how the heck did all these parasites get into the central nervous system? And we do know, if you follow my work, that the biggest base camp is in the gut, but still they are moving out of the gut, they're moving into the blood, they're moving into our central nervous system. And I've shared different videos. Make sure to go back and watch some of my videos on YouTube and Facebook, Live Disease Free. We have on YouTube, we have an infection playlist, so you can start to see and understand like how we got these infections, which ones we're dealing with, and then also like how are they getting past the blood-brain barrier, and that's what we're going to talk about today. So to lay a little bit of foundation, we know that the central nervous system is not a sterile environment. That's important to know. So microbes do get through. So that is That is important to know. That is not a sterile environment. They know that there's different microbes that can get into the central nervous system. We don't want a lot of them, absolutely, or obviously, but they do. And another really important thing to know is that our white blood cells, or our immune cells, we need them to go into the central nervous system because they are patrolling, they are protecting and defending us, because the central nervous system is not a sterile environment. It's really important to establish those two things, because in the way that we treat multiple sclerosis right now, it's based on the theory that our immune system is attacking the nerve tissue or the myelin sheath. And so then a lot of the drugs, a lot of the disease modifying drugs, they are either suppressing our T cells and our B cells, or they're preventing them from moving into the central nervous system, or decreasing their presence in the central nervous system. And then if we do that, we are at a higher risk of infections in the central nervous system. So it's kind of trying to stop the war where the good guys are fighting the bad guys, but it's going to end up in disaster because the bad microbes have less opposing them. So very important to understand that although the way that we treat multiple sclerosis today is that we just say, well, our immune system is attacking our tissues, so we have to find ways to decrease. And also they're saying that, with this influx of these immune cells into our central nervous system when we have MS, that's because of our leaky or altered blood-brain barrier. When in fact, I believe is that there's a lot of infection and our troops are being called in to treat the infections. That's what I believe. And that makes more sense. That is more consistent with the function of our immune cells. So it's important to kind of lay that foundation first to really understand what the blood-brain barrier is. Actually, for the blood-brain barrier, it is the blood vessels that are present in the brain, in the central nervous system. The lining of them is special in that is what acts as the barrier. So it is the lining of the vessels in the central nervous system that prevent certain things from crossing into the central nervous system. So it will allow nutrients, it allows certain ions or molecules, but it will keep out toxins, it's supposed to keep out pathogens. That's in a perfect sense, right? If our immune system is strong and functioning and our body is healthy. So that's what it's supposed to be like. What are some of the reasons that we could end up with a leaky or altered or compromised blood-brain barrier? Well, we know that certain drugs will compromise the integrity of this barrier that protects our central nervous system. Things like a few drugs that many of us would not use, like morphine. Let me just see what they are here. Cocaine, morphine, meth or methamphetamine. So we wouldn't have to worry about those because most of us have not used those, but also alcohol. So this is where a lot of us, back in the day, if we were drinking alcohol as a young adult, etc., or even as an adult, we have to understand that there are negative consequences to our health. So it definitely, if we're drinking regular alcohol, that can definitely compromise our blood-brain barrier, but also nicotine could also. So those are just a few drugs, and I'm just mentioning them because that is in the literature. What I believe is the biggest reason that we have the compromised blood-brain barrier is actually a disruption in the microbes that live in our body. So for many of us, like indirectly, antibiotics can definitely impact our blood-brain barrier in a way that, myself included, on quite a number of antibiotics when I was young. And then that decreases the health-promoting microbes, and it allows the disease-causing microbes to really multiply and become more populated. And it has been shown in research that changes in our microbiota, which is literally just the microbes that live inside of us. So as we decrease the health-promoting microbes and we increase the disease-causing microbes, that can definitely change the permeability of our blood-brain barrier. And so toxins can come in, and probably also the microbes can come in. So when we have a couple of really interesting things that I wanted to share with you about, let's see where I put it here. So the blood-brain barrier leakiness and that is loss of tight junctions. And they call them tight junctions. It's basically that the cells are really tight together, and that's in our intestines, but also in the vessels in our central nervous system to make sure that only certain things go through. And the activation of certain enzymes, it facilitates the degradation of the cellular matrix and causes the blood-brain barrier disruption. So with the antibiotics, again, when we're taking them, then we have this disruption in our microbiome. And sometimes it's the metabolites that these bad microbes produce, so like their toxins they produce. But sometimes it's also just our immune response. Certain, they call them cytokines and other immune molecules that are released that can, all of these things can increase the permeability of our blood-brain barrier. So for myself, I'm just using myself as an example, and maybe you guys can relate. So I was really young, and as a young child, I was on a lot of antibiotics for strep throat, tonsillitis, whatever. And then as a teenager, I was on tetracycline for months. So my microbiome was really out of balance, really decreased the good, healthy microbes, and also allowed the bad microbes to become more populated because I followed a typical North American diet. I had white bread back in the day, lots of processed carbs. And so I was feeding the bad, and I didn't realize I was so out of balance. And so that is called dysbiosis, being out of balance in your intestines. That can cause the immune response so you have the negative bad bacteria and microbes in the intestines producing those metabolites that, as it becomes more and more of a problem, because I had a history of constipation too. And you guys can let me know if you can relate to some of these symptoms, because the students that I work with, most of them have really significant constipation. Some have diarrhea, but it's always a real disruption in regularity, like not a nice, healthy bowel movement, unless you've been working at it really hard. But for most people, it's a lot of constipation. So as I had more parasites, and parasites are not just worms, but they're bad bacteria, they can be fungi, etc. And they're producing these poisons, toxins, and my immune system is fighting it. So over years, right, that helps to break down the blood-brain barrier, to make it altered, make it more compromised. And in the research that I've looked at, they feel that the leaky gut happened first with MS, and then the leaky blood-brain barrier happened next before the lesions happened in our central nervous system. And that would make sense because the gut is where the problem starts. And then as these microbes become more populated and our immune system becomes more suppressed or hampered with life, with lifestyle, plus these infections, then we have altered blood-brain barrier directly through the bad microbes, and also possibly directly through the immune response, the cytokines, etc. And then we allow these different microbes to move into the central nervous system. And then we start getting plaque, or I should say lesions, depending on the disease. Like with Alzheimer's, it would be more plaque. And we have more of these disease-causing microbes in the central nervous system. But as I'm talking about all of this, I just want you to remember that, yes, we do have infection in the central nervous system, but the biggest base camp of the problem is still in the gut. And how do I know that? It's through the experience of working with hundreds of people. Treat the gut, and yes, we may have to use things that help to decrease the population in the central nervous system also, but we go really far with treating the gut. And so the thing is that, like, why is it that some people, they, let's say, go on antibiotics and they don't get the neurological symptoms that we do, where we do? And that is really, really interesting. And it may have very much to do with the integrity of the blood-brain barrier. So it seems that more of the people that are suffering with neurological diseases have more of a compromised blood-brain barrier than people who, let's say, just get cancer or they have arthritis. They may not have as much of a compromised blood-brain barrier. And the things that we see right now that would lead up to that, the drugs I mentioned, the immune response to certain infections. And so it could be that we have certain microbes and the metabolites from those microbes, and also in its circumstances. And another factor that I really believe, it's like what parasites you're introduced to in your environment. So there's a lot of different factors, and this is part of putting this whole pieces of the puzzle together, is that it's not just, that you're on antibiotics, but it's also what parasites So I was on a farm, and we had pigs, and we had cattle, we had horses, we had dogs and rabbits and cats, and we had so many different animals. And I was with animals a lot. So I was really susceptible to picking up a lot of parasites, where maybe somebody who was living in town didn't have as many. Again, it depends if they work in the dirt, if they're gardening. There's many ways we're exposed to parasites. Municipally treated water, like some places where we've grown up, they're really good at keeping the water clean. And sometimes the chlorinators go out and you're drinking raw water for a few days and you have stomach aches. So it's really what you like, number one, how your the small intestines, large intestines, how they were compromised with the overuse of antibiotics, which microbes you were exposed to, and then lifestyle. And so this is going back to, how did I get to this place with chronic disease? And that's why a lot of our students, they map this all out. It's like, oh yeah, I was on a lot of antibiotics at this time in my life, and I had bladder issues, I had strep throat, I had tonsillitis, or I was on for acne. And then, as a teenager, I drank too much, or I smoked cigarettes, or whatever it was, or I partied, or I ate a lot of sugar. I was addicted to sugar. These are different things that all will make the problem worse. And some of these factors will directly or indirectly impact the blood-brain barrier. But this is something that I don't think a lot of people are talking about. I've been in the MS field for so many years, and I'm just starting to see research talking more about the blood-brain barrier, but it's commonly understood that it's altered or compromised in MS and other neurological diseases for sure. And when it is compromised or altered, that would allow for different poisons to go into the central nervous system, but also different disease-causing microbes. And that would really make a lot of sense as to why we have more neurological symptoms, where maybe somebody with, just eczema or asthma, or they're not dealing with the neurological symptoms. All right. I'm so happy that what I'm saying is making so much sense. And that's the sad reality of where we're at today with healthcare, is that, and I do respect our doctors, and I do respect my GP, although I never see him. But I know they're trying to do their best. And yes, our healthcare system is very good at crisis intervention. But when it comes to chronic disease, we have a lot of work to do. It's like a long time ago, our doctors have lost the ability to recognize parasites and to treat parasites, and we don't have good tests. And that is what's causing all the disease symptoms. And if you're new to this and you say, Pam, that kind of makes sense, but I don't know, I've never heard this before. I have a ton of videos. Go to YouTube, Live Disease Free, the playlist, go to the infections playlist. I've shared Dr. Alan McDonald finding many, many small worms in every MS spinal fluid that he tested. And also the juvenile and immature larva tapeworm in the central nervous system of MS patients. We know that Lyme is found there. We know that Borrelia, and I'm sure others too, fungus. So there are lots of studies showing the presence of these microbes in the central nervous system. And what I believe is that living on planet Earth, that a lot of us probably have a somewhat, maybe a little bit compromised blood-brain barrier, but it's those of us that have the really serious chronic disease, we have more of a compromised blood-brain barrier. And how do I know that? Because these lesions are found in people that don't have MS. And that's why we can't forget about what's going on in the intestines, because we can have infections in the intestines that are irritating nerves and giving us neurological symptoms. And how do we know that? Because as the students are treating the infections in the gut, their neurological symptoms are going away also, and they still might have the lesions through the MRIs, and we've seen this. So this is where we really have to say that the lesions, they shouldn't be there. They are probably due to a compromised, altered blood-brain barrier, for sure. That is definitely the tight junctions aren't so tight, or maybe these worms are burrowing through, I don't know. And it's present in people that have chronic disease and not. And so it's always the degree of the infections, the population, because a lot of us have symptoms for years before we step into the world of chronic disease. So we're out of balance for years. And then we end up at some point where our immune system is kind of like the camel's back that is overloaded and it just can't handle one more thing. And then we end up with basically a lot of immune dysfunction, etc. All right, so I'm just going to go to your questions for a moment, but I hope that this helps you to think about something that you probably, have you thought about the blood-brain barrier if you do have multiple sclerosis or if you do have another neurological disease? Maybe let me know, because that's not something that our doctors have ever talked to me about or that I've really seen a lot in research. We're starting to see more information about the leaky gut, and we're starting to see research coming out about how the microbes are different in the intestines of MS patients versus other healthy people. But I haven't really heard a lot of experts talking about the blood-brain barrier. But that's very, very important because, again, the blood-brain barrier, it acts like a barrier to keep toxins and disease-causing microbes out of our central nervous system. And again, I have done videos where I've shown research that when you have a parasite present in the central nervous system, that shows up as a lesion on an MRI. So why don't we consider that that could possibly be our problem? I don't know. That's a good question for our doctors. All right, so I'm going to see if you guys have any questions for me. Hi, Jill. Hi, Alexander. Thank you for sending me hugs, Janet. I really appreciate it. Hi, Joanne. Janae, hi. I am so sorry. She says, I'm now completely disabled because of the progression of multiple sclerosis. I have lost ability to walk. Janae, there still is hope for you. And I say that I can't promise that you're going to walk again, but what I can say is that we have students that joined and they were so disabled they had not walked for at least 5 years or longer, some of them 10. And the more they treat, they are getting their mobility back. So they are starting to take steps again. But again, it takes, number one, treating the infections. But if you haven't walked for a long time, you also have to build back your muscle mass too. So it's a combination of treating the infections and then building back your muscles. But your only hope, your only answer is going to be in treating these infections because that's what's making you disabled. Hi, Julie. Hi, Sheila. You need so much help. You have MS and thyroid. Sorry. A little frog in my throat. I think I've been talking too much today. So cancer is also an infectious disease. So is multiple sclerosis. The thing is that different microbes like to live in different parts of the body and cause different symptoms. So with cancer, we've known for years that fungus is really involved in cancer. But now research is starting to show that small parasites are also involved with cancer. So when you have MS and cancer, it means that you're really, really out of balance. And it is very common, and I've done a video on this, MS and other related disorders or conditions. If I were you, I would go back and watch that, Sheila, if you haven't seen that yet. But in that, you'll see that when people have multiple sclerosis, sometimes they've had cancer before the MS, sometimes it's after the MS, or they've had inflammatory bowel disease, or they've had epilepsy, or usually 3 to 5 diseases travel together. And so, when we first get a diagnosis, we think, oh my gosh, I have MS. And it's brutal, yes. But what we don't realize is that that's not the only disease that we may end up with. Diabetes is also really common with MS. So if we don't treat these infections, we find that our immune system gets weaker and weaker, and then other critters move in, and they like to live in different areas. They like to cause different symptoms, and then we have to take different medications. It is a downward downward spiral if we don't treat these infections. So I would really encourage you both to start to, number one, you can start prepping. You can watch my videos on YouTube. I have a playlist on the eating plan. And the Live Disease-Free diet is so powerful because you're decreasing the food to those infections. And you'll start to see improvements within a week or two, especially as you get the carbs low enough. You could see improvements in a week. If you're eating a ton of sugar, you might have a rough week yet. Like, you have to eat often, but the right foods, and just to keep your blood sugar steady, you're going through sugar withdrawals. But after that, you will notice like bladder improvements, sleeping better, happier. People notice neurological symptom improvements, whether it's feeling stronger, less pain, less neuropathy, less spasticity. All of those things happen. That just means that you have decreased the food to those infections and they're less active and the inflammation starts to go down. That really builds up your belief system so that you go, oh my gosh, this is real. And so then, go through, I've got other videos on how to go through the prep phase as far as, making sure you're sleeping well through the night, making sure you're having daily bowel movements, looking at your blood work, supporting your physiology, cleaning up your environment. Check all those things off. And then you're ready to start treating. And the treatment is treating parasites. And we found parasite drug treatments are most effective, and then treating fungus next, and then taking a break. And that's one cycle, and going through multiple cycles. So the people that are severely disabled, they might do 12 to 18 cycles. People that are moderately dealing with MS where they can still function, they might do 4 to 6 cycles. And the better you are at going through the prep phase, the more success you have in the prep phase, then the more success you'll have in the treatment. And so that's what we do in the Live Disease-Free Academy. So if you're someone who's just finding me, hi Ronnie, hi Maureen, hi my Comage, oh hi Kevin, hi Jessica. You believe that, Jessica? Absolutely. Billy, sorry to hear that you have MS also, and you realize that you have to do whatever you have to do to heal yourself. Absolutely. You've watched and listened to over 5,000 talks and lectures, the vast majority of people. So the key is, Billy, that there are very few people that are talking about treating the cause. There are a lot of people talking about diet and exercise and supplements, but really we don't have MS because we are not following a certain diet, or because we're not taking certain supplements, or we're not exercising enough. We have these symptoms because we have infections that are causing it. Awesome. Good job, Janae. Hi, Bambi. Hi, Kansas. I'm so sorry you've had MS since your teens. Make sure to start to watch my stuff, start to implement, start to feel better. Hi, Julie. Hello from the Enchanted Forest. Yes. Hi, Karen. This sounds familiar. Absolutely. Christy, everyone is saying makes so much sense. Yes, it does. Janae, hello from Northern Rocky Mountains. Joanne, I'm having bad intestinal issues. So again, Joanne, I said the base camp of these infections, where it all started, where the highest population is in the intestines. And then over time, they move out to different organs, tissues, central nervous system, and then we get different disease labels. Big pharma companies are not doing anything for the autoimmune disease. No, unfortunately, what they're doing is they're trying to manage our symptoms, but really we're on maintenance drugs. So we are altering our immune's response to these infections. And so that way we're sick forever. We continue to become disabled. We have to treat the cause, the infections. We don't need to suppress our immune system. You just got your most recent Tysabri infusion. It's really important to really research these drugs. What I really encourage you to do is to go onto pdr.net, and also just even on their website. If you go on the Tysabri website, you'll see, when I was there last time, there's a big banner along the top and along the bottom that this drug can cause a rare brain infection that will kill you. There's nothing they can do. So again, what Tysabri is doing is decreasing the presence of your immune cells in the central nervous system, which will make you more susceptible to terrible infections in your central nervous system. So I'm not against pharmaceuticals, but I am against suppressing the immune system. So you're talking to your neurologist about getting off. Yes, absolutely. That's what I would do. Hi, Sam. So your legs are not strong. What can you do, Sam? Or Hilda. So if your legs are not strong, if you, like, first of all, get your belief system up. Like, learn about these infections. You know, I've got lots of science that I share. Learn about them. And then start to change your diet so that you start to see that this works. And you can notice some more strength. And I don't know if you're dealing with spasticity or weakness or what you're dealing with your legs. You said not as strong, so maybe weakness. But if you go low enough carb, between 35 to 40 total grams of carbs per day, you will notice improvements. And it's a little bit of an art getting to that place. That's why I've got lots of resources on Live Disease Free YouTube playlist. Go and watch those. And then when you're ready, if you need support in treating and building a game plan, finding the practitioners, accessing the treatments, that's what I help students do in the academy. And it's really exciting. We've had so many nurses that I've worked with. We've had a doctor join, and also a naturopath and chiropractor and physiotherapist. So these are all wonderful healthcare professionals that they're doing a lot of health promoting things, but they just don't understand about the parasites. And again, it should not be an issue. This should be dealt with normally in our society. But I believe there's just really not much income or future growth for companies in treating parasites. There's much more money and prosperity in these disease modifying drugs. You guys know what they cost. You've seen what the insurance company papers come to you. For the newer drugs, it's like at least $100,000 a year. So that's much more lucrative than treating some worms or bacteria, etc. All right, last couple of questions, and then I'm going to let you guys go. So, Maymuna, hopefully I pronounced your name correctly. So vitamin C, black seed oil. You have to focus. Don't focus on how better your health was. You have MS too. It's not easy disease at all. You know it's scary. Sugar sucks. Sugar feeds a problem. Gluten does not work with MS. You're right. Caffeine is not a good thing to have. So we would avoid all of those things. So what you would do is definitely change your diet, support the body, and then treat the infections. And that's what's going to get you your life back. Hey, Damien. So awesome. Yeah, Dr. I don't know about Kudra, natural product. So with herpes, just be aware that herpes is a virus. And what we found is that when you're really out of balance, when you have you have too many disease-causing microbes and not enough health microbes in your intestines, in your body, but mostly in your intestines, then it's called severe dysbiosis. And then your immune system is taxed. And at that point, viruses are more active. So it's fine if that helped you to decrease the activity of the herpes right now, but you'll have more long-term success as you restore balance to the microbes that live in your body. As you restore microbes, and of course, living a healthy lifestyle is part of that too. But the piece that everyone's missing is that you have to also decrease the bad microbes, increase the health promoting microbes. And then you'll find that viruses are really not an issue anymore. Awesome. Thank you so much for the beautiful comment. I'll read it a little later. It's quite long, so I just don't want to, I've got to go. Oh, I think it went through a few times. Awesome. All right. So hello, Danny. How do you get the medications for the parasites? So they require a prescription, and I help students find practitioners that can write prescriptions for them. The nice thing is that because this is a lost skill, a lot of practitioners, maybe they're willing to help us, but they don't have a lot of experience. So then you in the program in the academy, you will know the doses, which ones they are, how to take them safely. So we literally are teaching the doctors we're working with this information. Unfortunately, it is not well understood yet. It was years ago, but it's a lost skill. What about PPL who are having immune system blocker infusion getting the experimental vaccine? If you have any questions about the vaccine, make sure to send me an email to info at livediseasefree.com, info@livediseasefree.com. I can't talk about it here, so I will be, you know what'll happen. So if you want information about that, then just info@livediseasefree.com. And again, I'm not a doctor, I'm not a healthcare professional expert, but I follow tens of thousands of them. So then I will give you that information because that's not readily available. And it should be. We should have all the information we need to make the right decision, not based out of fear, but what is the best for us. All right, and last couple of here. Yes, it's parasites. All right, hello from New Zealand. Okay, I'm going to let you guys go. There's a whole bunch more here, but the key is the gut. Absolutely, all disease begins in the gut. I'm sure of it. So with that, if you are just finding me for the first time, I would really encourage you to watch some of my other videos, learn about the diseases, change your diet, watch my masterclass training too, but also the playlist on the eating plan. You're going to notice huge improvements. And when you're at that place, you're like, Pam, I believe it. I need help. I can't seem to get, the right healthcare professionals to help me. I need help to build a plan to treat these infections. That's what I help you to do in the academy. Then watch my masterclass training. And if you're ready, if you want the support, you want to join us, then fill out the form. And once you filled out the form, then you will get an email. Watch the Coach-a-thon because that explains the academy in great detail. And then you and I are going to chat and you can get started right away. All right, so with that, I'm going to let you guys go. Take care and bye-bye for now.